Okay, so today we have Dr. Joel Smith with us, who is a passionate and very active advocate and expert for the right to housing, particularly amongst disabled parents and mothers. And so I'm hoping, Joel, that you can help us understand how to analyze systemic issues under international human rights law. And to begin, for some background, we've just covered what a systemic issue is in the last module. So I'm hoping that you can start by giving us a real world example of a systemic issue that we and our trainees could all understand, and help us to see how recognizing the systemic nature of that issue really changed the conversation.
For sure, for sure. So, early in the pandemic, we had a global reckoning with anti-Black racism in the situation of George Floyd's death. And I feel like there was a moment where people finally began to understand the wrestling of the difference of individualized racism versus systemic racism. And I think it was such an important moment where, there were great conversations and great digging deep into, these systems that have been built over time have led us to a place where that sort of an occurrence happens far too often. And it being captured on video at a time when people were paying attention, I think was just critical in cracking open what is systemic, and then how do we begin to wrestle with and unpack this. And in a more Canadian context, we then also had this situation where the graves of a number of children that died in residential care under the Residential School Act were uncovered. And although Indigenous families have long talked about their lost children, it wasn't really understood until the tangible sense of there are children buried on this land and it's not marked and it's not recorded. So I think that these are two examples where we can look at, a systemic situation and how it evolves over time and impacts across generations. So in the context, if we think about Indigenous folks who, we know have some very high rates of being unhoused or housed in inappropriate, unsafe housing. I live in British Columbia, where we have the downtown east side, where there's a lot of folks who are not housed at the moment or precariously housed. This comes from generational trauma and the impact of colonialism over time. And so one of the aspects of thinking about housing in a systemic context is really um, looking at it not from an individual human experience, but rather as generational and systemic, and across really particularly in certain populations.
Yeah, that's extremely helpful because both of those moments were so vivid in the past couple of years. I think everyone can relate to that moment of reckoning.
Mm.
So to that end, I guess I'm wondering if you can now tie this to some of the research that you've done at the intersection of disability and the right to housing to give us a sense of what that looks like in that context, and if there have been any cases or scenarios where it's actually been addressed, what that looks like.
For sure. So, you know, a couple hundred years ago, some certain minds had some thoughts around what disabled lives um, were like and who was worthy. And there was very much a move to institutionalizing certain folks with certain disabilities. And over many generations, folks were just housed in institutions and basically packed away. And most disabled people didn't have a right to become parents or have children or raise their own children. There was a lot of folks who were sterilized without their knowledge, against their will. And this has not really, I believe, been unpacked fully. Although we now have these amazing international treaties that we can use to fight for our rights to housing, it doesn't mean it's easy. And so in my own research, I heard really clearly from moms, who made very thoughtful choices about becoming parents. Several of the women that I interviewed talked about, I got my education, I have a great job. I made decisions about when and at what time of my life I wanted to have children, and then suddenly they encounter barriers to their housing because if they don't own their house, We all know that very often people are evicted for, various reasons, which I'm sure the members of the committee will encounter. So women talked about this precariousness of housing and this inability for the systems and the folks that they're looking for housing to understand they have a right to be a parent, but they also need, fully accessible units that meet the needs of their disability and their parenting situation, whether it's one child or two children, if they're a wheelchair user or if they're deaf or blind. All of these things come together in the research that I look at. In housing, even though I was looking at sexual and reproductive health rights across the lifespan for women with disabilities, it really came down to having appropriate housing made all the difference to women's experience of parenting.
It's great. I'm hoping that based on that experience and your research, you could impart the review panel with some final words of wisdom or some advice on how they can analyze these complex systemic issues and ultimately work towards remedies that will actually improve the lives of marginalized populations.
So I really want to encourage the committee to be creative. Human rights is an ever evolving concept. And, as we've seen in the last 15 years, we've had a number of new conventions and new declarations that many states have agreed on and are implementing in their own country. And Canada has been at the forefront of signing on with these and being very engaged with the UN and with communities, but the solutions need to be creative. And the ways that we get from, systemic discrimination to full citizenship and inclusion is going to have to come through creative solutions, because we have a long history of colonialism and of discrimination against people with disabilities to unpack. We have a lot of housing that's not accessible. It's not accessible for families with disabilities. It doesn't meet the need of larger families often. And it definitely doesn't address this concept of aging in place. So I just really invite the committee to be creative and thoughtful and open to respectfully learning about communities that maybe they don't know a lot about.
That's a perfect way to end it. Thank you so much, Jewel, as always, for your brilliant insights. And yeah, we'll talk soon.